So yesterday was fun. George and Shaina both had their dental work done at the clinic. And I've been wanting to do Shaina's teeth for 3 years. She is in stage C, mitral valve disease, and has been there for 4 or 5 years, maybe. She will be 15 in a couple of months. And the cardiologist told me 3 years ago that I could not put her under anesthesia because her heart was so bad, her pulmonary hypertension was so bad, and that we just couldn't do it, which broke my heart because you all know that I'm kind of a fanatic about wanting to have good dental care for these dogs.
And that affects the heart as well.
And that affects the heart as well. So when she went to the cardiologist in September, he said, wow, I don't know what you changed, which we changed a lot of supplements. But he said her pulmonary hypertension is just absolutely controlled. Her heart has not changed at all. And she looks really great. So he said, I would say, go ahead and get it done because her mouth was so painful. Well, poor dear Shaina lost 23 teeth yesterday. They were so rotten. My poor technician, Cindy, literally held her breath while she was doing it. They were bad. I knew they were bad, and it was breaking my heart that she had all that in her mouth. So she has 5 teeth left. She has her 4 canines and I think 1 lower premolar. I think that's what she has left. But I'll tell you what, came home last night. We're making soup. We're using bone broth with just a little bit of ground bison, like finely ground bison mixed in it, so that she can get her heart meds and her supplements. And last night, she, with all of that dental work, she slurped it right down this morning. Already feels better. Doesn't smell bad, not leaving gunk in the water bowl. I mean, just a huge difference. And George, he is 12. He'll be 13 in January. He lost 7 teeth, which I was pretty shocked. I knew he had a couple small ones that were going to have to go, but what was devastating to me really was that his 2 lower the biggest teeth, they're actually premolars, but the biggest chewers on the bottom were both broken. They have 3 roots on them, and the back root, the top of the tooth, was sheared off on both sides. And he's an aggressive chewer, and I don't give them hard things to chew very often, but we've given them some, and apparently he broke both teeth. And he had to lose both major chewers on the bottom, which was upsetting to me. So as much as he loves to chew, I told him, buddy, no way. So he lost 7, and same thing. He had his bone broth with ground bison last night and this morning, and he's just bouncing around. Coming home yesterday, a couple hours after the dental, he was just bouncy and happy. I think they're going to feel a lot better. And he had some really foul odor in his mouth too, and I think it was those broken teeth. So they're doing really well. And I want to thank Michelle Allen. I don't know if she's on this morning, but I want to thank Michelle Allen of Monkey's House, because for years, Monkey's House probably started 5 years ago. For years, she's been bringing these old dogs with heart disease, pulmonary hypertension, cancer, you name it, diabetes, kidney failure, all kinds of problems to us. And we've never hesitated to put those dogs under anesthesia if their mouth was a cesspool. And I'm kind of mad at myself that I waited so long on Shaina. And, we get a lot of cardiologists who say, don't put these dogs under. I think if I had a class D, I wouldn't put them under. But, I've been really brave with the Monkey's House dogs. And they taught us a lot about how to really manage our anesthesia, really monitor these animals and get them through it. So Michelle Allen, thank you very much for allowing me over the years to work on the Monkey's House dogs and really treat them like they're our own and get them through this process. And it enabled me to be able to get through the process with Shaina yesterday. I sent Hugh pictures of her monitoring screen while she was under anesthesia with just a beautiful sinus rhythm, heart rate of 94, oxygen saturation of 98, blood pressure normal. She just flew through it. And, we shouldn't hesitate to get the heart disease under control, get them controlled. But makes a huge difference for these dogs. And once their gums heal in a few days, they are going to feel so much better. The other positive was because they were under anesthesia, I got to trim their nails really short, and really get them right down to where the quick is. And I also got to shave in between those foot pads and get all the hair out of there, like really get in there, because they were snoozing and nobody was pulling their legs back and fighting me. Shaina's walking so much better this morning, because her nails aren't trying to grab and curl, and she's not sliding on the hair. And we do have slippery floors. They're hardwood, and they've got a pretty good coat of wax on them right now because we're showing our house to people. So, she's walking better. She feels better. Her mouth is still tender. I went to wipe her eye, and she yelped at me because her mouth is tender. Going to give her a nice warm bath this afternoon because she has a lot of muscle soreness. You might have noticed when she was sitting in front of this, she's really crooked. She has scoliosis worse than any dog I've ever seen. She can't look straight. Her butt and her head don't line up. She's tender, but she's just feeling so much better, and that fast. And Cindy said while she was doing her yesterday, I said, well, this has got to be gratifying. And she said, oh, I just love doing dentals like this, even though, I feel bad that I'm removing all these teeth. She said, I know this dog is going to feel so much better tomorrow. And I said, I know she's going to feel so much better tomorrow. So boo on me for waiting so long. I did follow the advice of my cardiologist. But yay on me for putting together the right combination of supplements and diet to strengthen her heart and make it so that she was able to get through that process. And really, it was one of those things where I said to Cindy, look, if there's any tooth that's questionable at all, it comes out, because I don't want her to have to go through this process. I don't want to have questionable teeth that 3 months from now we're going to say, should have taken that one out. So if there was root exposure, and really most of her teeth were not questionable. They were just, some of them we were just plucking out. So how long did the procedure take? Shaina was under for just about an hour. George was probably under a little bit longer because his lower ones, the two roots that were not broken off were in there really strong. So Cindy had to do some work to elevate those and get them out. So his is a little longer. He's a little younger. He doesn't have heart problems. But I'll tell you, we monitor them so closely, and I was never, ever worried about Shaina during the entire procedure. Even with her heart being what it is. I had my stethoscope, I had my crash box, I had everything ready to go. But I never saw one blip in her monitoring that had me concerned at all. So,
what else did you do yesterday? Didn't you do 2 cat spays?
Oh, I did 2 cat spays for Carly, our pet sitter, and one of my technicians. She has quite a few cats, and she does a lot of kitten foster care. And she decided to keep 2 of her fosters. One of them, named Minnie, is about half the size of her sister, which is kind of like our Eggplant and Mittens. They're brother and sister. Eggplant's 7 pounds and Mittens is like 15. So you wouldn't look at them and think they came from the same mom.
And what sort of monitoring did you do with that?
So monitoring for these guys, first of all, we have IV catheters and we have IV fluids on board. We monitor blood pressure. We monitor body temperature. We monitor oxygen level. We monitor EKG with a printout so we can see what it's doing, not just hear it beeping. It's really important to, especially with these high-risk cases. I didn't leave the side of the table while Cindy was doing the dental. My technicians do the dentals. I do not do the dentals. You do not want me actually doing the dental procedure. Cindy's been doing it for 30 years. It's kind of like when I go to the dentist, I do not want the dentist doing my dental cleaning. I want the hygienist doing it. Cindy knows George's teeth had to be split in half with the dental drill in order to get those multi-root teeth out. I don't even know how to work the drill. Don't know how, don't want to know how. That's her job. She is well trained to do it. She has taken multiple courses in dental care, and dental is one of her specialties. So that's who works on our dogs. So anyway, really happy ending. And yes, my cat, I posted last night, the temporary cap that I have put on. You know, I was eating my dinner last night and I crunched down on something hard and I went, oh, that can't be good. Luckily, it wasn't the cap. It was just some of the adhesive, the really hard adhesive that holds the temporary in place. The outside piece of it came off. So I'm supposed to get the permanent on Tuesday. I'm hoping this thing can hang in for 6 more days. Please, please, please stay in place for 6 more days. Because it's a little tender. Not tender enough that I'm going to, go running to the dentist today. But talk about RX-D3 dosing for a 21-pound 4-year-old cab just diagnosed with a slight murmur and paternal history. So really, Kristen, ideally, you would run a vitamin D level to see where they are. I've done vitamin D levels on our guys. They tend to run a tiny bit low. Ours are a little bit smaller than your dog, but we give them 3 drops once a day of the RX-D3, and that's a safe dose. You don't want to overdo it. But ideally, you would get a test. If your vet can't do the test, we do have the test kits on the website. You can take the test kit to your veterinarian, have them draw the blood and send it in. Really simple to do. So, and that's actually cheaper than most labs charge. So, all right, everybody have a wonderful day. Today is Buddha the Cat's dental. And tomorrow is Stewie and Gabby getting their dentals. Then we're going to have nice, fresh breath for everyone. You once swallowed a temporary cap. Well, don't tell me that. Although I can see how it would be possible. And Gabby gets spayed tomorrow too, so